Hello, my name's Chris Howard and I'm the founder of Speech Cradle. And I'm so pleased that today we have Dr. Ruth Lawrence from the University of Rochester School of Medicine and Dr. Mary Applegate from the New York State Department of Health and the University of Albany School of Public Health. Welcome. I just want to know about those 20 years the two of you have worked on your program, Breastfeeding Grand Rounds. So I'm going to start with you. Dr. Applegate, what inspired the creation of Breastfeeding Grand Rounds?
It started with a grant from the U.S. Department of Maternal and Child Health, a SPRANS grant for special projects of regional and national significance. And part of the grant funded professional education for physicians and other healthcare providers. Dr. Lawrence felt that physicians needed more education about promotion of breastfeeding and helping women with questions that went above and beyond the kind of thing that nurses or grandparents or other members of the breastfeeding support team could answer. So the target audience was primarily physicians, knowing that inevitably a lot of non-physicians would get to watch it too, so the education would spread widely.
Dr. Lawrence, can you share with us what, in your opinion, were the highlights of the 20 years of Breastfeeding Grand Rounds?
Well, we focused on certain subjects. Just how do you do it, and why do you do it, and that kind of thing. We used experts. We didn't just get there and tell people what we thought was true. So we had Audra Naylor. She started Well Start in California. She went around the world and told women about breastfeeding. Miriam Labach, another one who worked with the World Health Organization and traveled around the world also, had a slant on breastfeeding that was very important. And so we used people like that.
At Speech Cradle, we have a particular interest in women going back to the workplace and making sure that everything goes smoothly with the baby and the transition of feeding. Can you share highlights from the program that Breastfeeding Grand Rounds did on women in the workplace?
We had several programs that focused on breastfeeding in particular settings, breastfeeding and women going back to the workplace, breastfeeding promotion and support in hospitals, in neonatal intensive care units, and in managed care organizations are the ones that I can think of off the top of my head. In our session about breastfeeding support in the workplace, we talked about what about in retail establishments, what about in places like fast food.
Well, and I'd like to proudly say that in Rochester, Kodak hired some lactation experts, and they were in all their different buildings. So we did have an impact, and corporation by corporation.
And not just in the executive suite.
That's right.
How about what mothers can do, and the fathers and the grandparents and other caregivers when that sometimes challenging transition from exclusive breastfeeding to partial bottle feeding has to take place?
There has to be some help. You can't just walk out on the baby. So that when you're trying to get the baby to take a bottle, you need someone who doesn't smell of milk. Because as soon as you pick up a breastfeeding baby, if you smell of milk,
the baby's not interested in anything else.
That's right.
Thank you both so much. Once again, it's been wonderful to have you here today and to capture this for posterity and share it with the world. I'm sure that you want to know more about Breastfeeding Grand Rounds now, so I want to mention that you should look at the link below this video and check out the expert speakers at that series. And thank you both so much for being here today. Thank you for watching.